Hi, Dr. C here. Today I'm going to talk to you a little bit about pain and how activity can actually relieve it. Chronic back pain, the pain you experience when you stand up and it's hard to get upright because you've got back pain that makes you want to stretch out, isn't always just a mechanical problem in your spine. It's more a problem in how your brain is processing the information that your spine is transmitting. When you first have an injury to a disc or a joint or a ligament or a spinal nerve, what happens is the injured tissue begins to signal. These peripheral signals are first stimulated in receptors called nociceptors. And these nociceptors are responsible for transmitting these sensations of burning, aching, or stabbing to the brain. The nociceptors convert chemical pain from leaky discs or mechanical pain from irritated facet joints, or even thermal pain from a burn into electrical signals, and then these signals propagate up the spinal thalamic tract to the brain. The signals first travel up the peripheral nerve. They enter the spinal cord at an area of the spinal cord called the dorsal horn. And the dorsal horn is sort of an amplifier or a soundboard. It decides how loud the signal of pain needs to be as it's transmitted towards the brain where you interpret it. If the injury is mild and resolves quickly, well, then it doesn't get a very loud boost going through the spinal cord, and then when it gets to the brain, it isn't terribly intense and it tends to resolve fairly quickly. But if the irritation at the nociceptor, remember that very first receptor that begins transmitting the pain signal, if that continues even for just a few hours, what you'll start to see is the dorsal horn activates and it starts more intensely transmitting the pain signal. Other neurons get involved, they continue to amp up the intensity and they amp up the frequency of the signal transmission, and then the brain also starts to alter the way that it interprets the information. It starts to signal its own amplification system, and what you can wind up with is a very intense, lingering, long-lasting pain that can go on even beyond the time where the peripheral injury, the tissues that originally started signaling this process, have healed. You're left with a chronic pain state. So now the spinal cord has become hyperexcited. It transmits too much information. It amplifies the intensity of the signal. The brain, as it receives the signal, is also amplifying it. And then it's shutting down the dampeners, the signaling that would ordinarily be used to calm things down. And the windup happens, gets more and more intense, and you're left with screaming alarm in your head of terrible pain and injury, even if the injury is resolving. As these pain signals enter the brain, they don't go to just a brain pain area. They actually spread out into a lot of different areas of the brain, each one responsible for a different action. Part of it goes to the sensory cortex. This is a part of the outer covering of your brain that tells you where the pain is. Part of the signal goes to an area of the brain called the insula, and the insula is responsible for interpreting the intensity of the pain. The anterior cingulate gyrus receives input, and it's responsible for telling you how much you need to worry about this pain. The amygdala tells you whether or not the pain is dangerous, and the prefrontal cortex tells you what this pain might mean for your future. When all of these areas of the brain get signaled at one time, your brain moves into a threat mode. It starts to try and establish whether or not this particular injury is even survivable. And if it is, what you're going to need to do to stay alive. Your brain is basically no longer saying, I have an injury. It's saying, I have a severe injury and I need to figure out what has to happen in order for me to survive and recover. And this is where the fear response kicks in. It's biological. You start to develop a fear of the pain, and you start to develop behaviors to avoid that pain. Once the amygdala has determined that the pain is dangerous, then several things happen. First, your attention focuses on your pain. It becomes the most important thing that's going on in your life. That's a physiologic survival response. Second thing that happens is the competing sensory input is suppressed, including activities that you might otherwise engage in to try and get relief. And the third thing that happens is you start to store fear-paired memory. This is classical conditioning. It's no different from Pavlov's dog salivating at the sound of a bell. Only you've learned to develop an avoidance response to the pain that you're experiencing. This is the point where the patient comes to me and says, every time I move, my back locks up and my legs give out from under me and I feel paralyzed. And so the brain has told you to stop moving. You've developed tremendous fear around moving, but in reality, movement is what is going to retrain your brain to stop paying too much attention to these signals and to allow the tissues to heal and the nerves to reset. And the reason movement works is it resets the signal balance inside the spinal cord. Rhythmically, by getting up and getting moving, the nociceptors start to fire rhythmically again. And this does several things. First, it activates the gating circuits. And these gating circuits start to override the pain signal with normal sensory input. The A beta fibers override the A delta and the C fibers. They stop the transmission of the pain signal and start allowing the transmission of normal movement sensation to be put through the spinal cord and to the brain. Next, the descending inhibitory pathways are turned back on, and these physically block the incoming pain signals before they reach the brain, or at least modulate and dampen them. And finally, the microglia in your brain start to calm down and turn down the volume of the pain that you're experiencing. And so there are actual physical changes that occur in the spinal cord and brain with movement, with physical therapy, with walking, with resuming normal activity, even when your brain is screaming at you that you need to stop moving because you're injured and you could be left permanently impaired. And this movement, this activity, doesn't just heal the tissue by strengthening the surrounding muscles and joints and ligaments. It actually heals by changing the way the sensory information is transmitted. The pain fibers lose their dominance and the safety fibers regain their dominance, basically. And then the threat starts to resolve. Your brain no longer believes that life and limb are in danger, and it starts to turn off all of the signaling that had previously been amplified by the injury. And if you don't start moving, none of these effects will ever take place. That's why once you go to bed and you are afraid to do anything for fear that your back is going to go out on you, you actually create a self-fulfilling prophecy where every time you move, it feels like your back is going to go out on you. So chronic pain is learned hyperexcitability, and you have to unlearn it, basically. And the way you unlearn it is by exposing the body, the spinal cord, the tissues, the brain to normal inputs again. And this happens through repetition. So that's why we say as soon as you experience the injury and you've established that a bone isn't sticking out of the skin or that your leg actually will function, you need to get up and you need to start moving. Don't go to bed, don't lie down, and don't let this amplification system take over. I'm Dr. C. Thanks for watching.